5 patients walked out of an Ebola ward this week, alive. But beyond the hospital gates, the numbers kept rising. More than 1,100 suspected cases, hundreds of samples still waiting to be tested, and a virus with no approved vaccine still spreading across Congo and Uganda. 5 people beat Ebola. The question is how many others haven't been found yet. In Bunia, doctors applauded, families celebrated, and for a moment the outbreak seemed to blink. 5 patients walked out of an Ebola ward this week alive. In Eastern Democratic Republic of Congo, 5 Ebola patients have recovered, offering a rare moment of optimism as health officials battle what is now one of the largest Ebola outbreaks on record. World Health Organization Director General Tedros Adhanom Ghebreyesus announced the recoveries during a visit to Bunia, the epicenter of the outbreak in Ituri province. 4 patients were discharged on May 31st, following the recovery of another patient days earlier.
This outbreak is caused by the Bundibugyo virus, for which no licensed vaccine or treatment currently exists. But this is not without hope. Ebola caused by the Bundibugyo virus can be survived with good medical care, and some people here in Ituri have already recovered. Seeking care early makes a real difference.
I had a meeting yesterday with some community leaders, and people believe that this thing cannot be, people who have Ebola cannot recover. And what our colleague told us is, this is wrong. They can give the medical care to help a patient recover. So people can recover. Of course, we're working on vaccines and treatments, but that doesn't mean that people cannot recover from Ebola. So that's, I think, a strong message.
The outbreak is being driven by the Bundibugyo strain of Ebola, a rare variant for which there is currently no approved vaccine or treatment. While the recoveries are significant, health authorities warn that the wider situation is deteriorating rapidly. Africa CDC said that more than 1,100 suspected cases are now under investigation in the Democratic Republic of Congo and neighbouring Uganda. As of May 31st, officials had confirmed more than 260 infections and 43 deaths across the 2 countries. Medical charity Médecins Sans Frontières said the response is struggling to keep pace with the spread of the virus.
The reality today is that nobody knows the true scale and severity of this outbreak. New suspected cases are being reported daily, yet hundreds of samples remain untested.
The outbreak was declared on May 15th and has spread across multiple provinces in eastern Congo, including Ituri, North Kivu, and South Kivu. Uganda has also confirmed cases linked to cross-border transmission. Health workers say testing shortages, delayed laboratory confirmation, and difficulties tracing contacts are hampering containment efforts. The situation is further complicated by conflict, poor infrastructure, and growing resistance from some communities. Doctors have reported attacks on treatment facilities and hostility towards burial teams enforcing strict Ebola safety protocols. Traditional funeral practices remain a major challenge because the bodies of Ebola victims can remain highly infectious after death. Meanwhile, health authorities in Brazil are investigating 2 suspected Ebola cases involving travelers recently returned from Congo and Uganda. Initial testing identified other illnesses, including meningitis and malaria, but officials say Ebola has not yet been ruled out. The Democratic Republic of Congo has faced Ebola 16 times before and successfully ended every outbreak. This is the 17th. But with suspected infections now past 1,000 and the Bundibugyo strain spreading into new areas, health officials say the race to catch up with the virus is becoming more urgent by the day. A Kenyan court has temporarily suspended a United States plan to set up an Ebola quarantine facility in Kenya after strong opposition from doctors and civil society organizations. On May 29th, the High Court in Nairobi suspended any agreement related to the facility until petitions challenging the plan are heard on June 2nd. Senior US officials said the 50-bed unit at an Air Force base in central Kenya would serve Americans who have been exposed to the virus but are still asymptomatic. In an order late on May 28th, High Court Judge Patricia Nyaundi ordered the government not to admit any person exposed to or infected with Ebola under the proposed agreement until the legal challenge filed by the Katiba Institute was resolved. The Katiba Institute said in its lawsuit that the quarantine plan raises grave constitutional concerns regarding the rights to life, health, fair administrative action, public participation, and parliamentary oversight. The Kenya Law Society urged the court to nullify any US-Kenya agreements, citing public health risks, a lack of public participation, and Kenya's insufficient, high-containment infrastructure required to safely manage such a facility. Adding to the pressure, a Kenyan doctors' union issued a 48-hour strike notice, accusing the US of avoiding Ebola on its own soil and turning Kenya into a dumping ground.
As the vanguard of Kenya's healthcare system, we are utterly disgusted by the government's apparent willingness to trade national biosecurity and the lives of its citizens for foreign aid.
On May 28th, the Kenyan government had allowed the US to use land at an Air Force base in Laikipia, central Kenya, to set up a quarantine facility. Kenyan authorities stressed that any international agreement would strictly follow the country's laws and health policies, adding that the government had taken all necessary measures to protect the nation's borders and ensure the safety of its citizens.
Anything that comes from an international request, it goes by the laws of Kenya. So we will not be breaking the law to have a conversation with partners. Not just the US, but any other partner. It goes by the laws of Kenya. So we want to affirm that our country we are ready, we are capable, and the ministry, we have taken all actions to ensure that we continue being guided by our healthcare workers and our policies to protect our boundaries and also to ensure that every Kenyan is very, very safe.
Some US health experts, meanwhile, have criticized the plan, saying it could discourage Americans from joining the Ebola response. The Trump administration has said the plan will allow patients to more quickly access care and will protect Americans at home. Last week, a US citizen who was treating patients in the DRC as a medical missionary was confirmed to have contracted Ebola and moved to Germany for treatment, along with 5 others who were exposed. A 7th person was taken to the Czech Republic. The Trump administration has said it cannot and will not allow any cases of Ebola to enter the country, unlike during the 2014 to 2016 Ebola outbreak in West Africa, when several infected US nationals were treated on US soil. The planned facility in Kenya is due to be staffed by members of the US Public Health Service, a uniformed branch of the Department of Health and Human Services. More than 30 were trained in Washington for 3 days and left for Kenya on May 27th. Kenya has pushed for the facility to be open to all nationalities, not just US citizens, but it is not clear if that will be the case. The US State Department said it would commit $13.5 million towards Kenya's Ebola preparedness efforts.
We cannot and will not allow any cases of Ebola to enter the United States. And so the State Department and other agencies represented here, the Centers for Disease Control, HHS, others are working very, very hard to contain this crisis to the countries where it's currently located, particularly the Democratic Republic of the Congo.
Since May 15th, the Congolese government has confirmed over 1,000 suspected cases and at least 220 deaths. However, the World Health Organization suspects the true scale is much larger due to weeks of undetected spread. the virus has also crossed into neighbouring Uganda, which has reported 7 cases and 1 fatality.